My name is Yael Moskowitz, and I'm a freshman in the University of Michigan Nursing School, and today I will be telling you about a patient who came in with a chief complaint of shoulder pain. History of present illness. Patient is a 54-year-old Caucasian female. Her vital signs are stable: blood pressure 142/92, heart rate 82 beats per minute, respiration 16 breaths per minute, temperature 37.2 degrees Celsius. She came in with a chief complaint of shoulder pain that began 3 years ago and has lasted on and off since then. She has pain in her right rotator cuff, specifically on the front part of her upper arm, and the pain is worse when she makes overhead movements. She rates the pain intensity at a 2 out of 10 when resting, but says certain positions make it an 8 out of 10. The pain is constant, with movements such as reaching overhead or outward aggravating it more, and these motions bring a sharp shooting pain. She has tried anti-inflammatories, which she reports help with the general dull ache, but does not help with the motion-induced pain. She has also tried ice and heat, reporting no relief from either. She reports no range of motion problems or muscle weakness, only pain in positions noted before. She saw her primary care provider, who suggested an MRI. She reports trouble sleeping on her right side, which wakes her up, and her daily overhead movements are limited. The pain is primarily relieved with rest, and after use it's very painful. It is also important to note that she has rheumatoid arthritis, but believes that this issue is unrelated. Health history. Patient was diagnosed with rheumatoid arthritis at age 41 and also has hypertension, which is controlled with a low dose of lisinopril. Her immunizations are up to date, including a flu shot from this year. She's allergic to 2 medications, penicillin and erythromycin. And she has had 3 previous surgeries: hernia surgery at 6 weeks old, and 2 C-sections, 18 and 16 years ago. Her current medication is a 30 milligram dose of lisinopril once daily in the morning. Functional assessment. No reported drug or alcohol use. Exercises 1 to 2 times per week. Restless sleep averaging 5 to 6 hours a night. Diet is reported as generally healthy and includes 2 cups of coffee daily. Psychological data. Reports outstanding family dynamic, married with 2 children. No trouble with any interpersonal relationships. Primary stressor is health concerns with her 16-year-old son. She has no environmental hazards and is involved in her community. She has a double master's degree in social work and special education. She gets a physical exam every 2 years and a pap smear and mammogram yearly. Family history. Hypertension, type 2 diabetes, and heart disease on both maternal and paternal sides. On maternal side, history of dementia and early-stage Alzheimer's, and her father died of congestive heart failure at age 81. System number 1, musculoskeletal. Review of systems. Patient is positive for limitations in performing daily activities and pain in rotator cuff muscle. Patient denies swelling, redness, warmth, deformity, limitations to range of motion, or weakness. Physical assessment. Upon inspection of muscle mass and bone structure, they were found to be symmetric in size, shape, and length. Posture was straight and gait was smooth and even. No evidence of scoliosis was found. All joints were palpated and assessed for range of motion, erythema, inflammation, warmth, pain, and crepitus. TMJ, neck, elbows, wrists, fingers, hips, knees, ankles, and spine were all negative for those symptoms. However, the right shoulder was found to have pain. The muscle strength of the deltoids, biceps, triceps, wrists, fingers, hips, hamstrings, quadriceps, and ankles were all rated at a 5 as they were able to meet force with full resistance. System number 2, cardiovascular. Review of systems. Patient is positive for hypertension. Patient denies chest pain, arm or jaw numbness, history of heart disease, murmur, change in exertion tolerance, fatigue, palpitations, or difficulty lying flat. Physical assessment. Patient was inspected and palpated over the 5 key areas, and there were no lifts, heaves, or thrills found. Patient was auscultated over the 5 key areas: aortic, pulmonic, Erb's point, tricuspid, and mitral, both with the diaphragm and the bell, and sitting up as well as supine. The S1 lub sound of the AV valves closing and the S2 dub sound of the semilunar valves closing were both heard in each place. No abnormal sounds of S3 or S4 were heard when the patient was rolled to their left side. Pertinent system number 1, peripheral vascular. In the Science Direct article from June 2008, Dr. Singer states that hypertension is a key risk factor for the development of peripheral arterial disease. Therefore, it is important to inspect for changes in the peripheral vascular system in patients with hypertension. Pertinent system number 2, neurological. In the NCBI article from June 2011, Jill Goldman states that the average lifetime risk of developing Alzheimer's disease is 10 to 12%. This risk at least doubles with the presence of a first-degree relative with the disorder. Therefore, it is important for this patient to get neurological testing every so often to check for any changes.